Should we start?
Start at 4, sir.
Okay. Will you be initiating a welcome note or something?
No, sir.
Okay. Hello, everyone. My name is Dr. Nitin Chawla. I'm head of pediatrics at KIMS Cuddles Gachibowli. And today I will be helping all of you towards improving your skills in pediatrics. Now, when we talk about field of pediatrics, there are certain specific and very targeted things which we have to remember for the sake of exam. Today in our discussion we will be taking short notes relevant for your exam and a brief note. Topic for today's discussion in short note are displayed here. First is immunization schedule of children, and second is treatment of cerebral palsy. So when we talk about treatment of cerebral palsy, we should remember that cerebral palsy is associated with the damage which has happened in the brain, and this damage has actually affected the brain, and further symptoms whichever we see in the child is because of this damage. This can happen in uh, prenatal stage, that is when the child is in womb. This can happen at the time of birth, and this can also happen postnatally because of infection. All said and done, for the treatment of cerebral palsy, our focus is primarily on individual disabilities, and our uh, main agenda is to improve quality of life of this child. And when we improve their quality of life, we do this by managing their symptoms, enhancing their mobility, and providing independence to them in doing whatever their usual life demands with the capacity which they are having. And this task is not simple. It needs multidisciplinary approach. There are key areas where many specialists are needed. To name a few, there is need of a physical therapy expert who is going to help the child to improve his or her strength and flexibility of muscles so that all the necessary motor skills are achieved. And while doing this, we also prevent joint contraction and muscle stiffness. Then, occupational therapist whose work is mainly to improve daily uh, daily usage of skills such as unbuttoning and buttoning, such as usage of spoon, fork to eat, usage of toilet, usage of assistive devices, if any, during provided during the treatment for cerebral palsy. Third will be speech and language therapist. If somebody is having speech delay or abnormal speech, or there is deficiency in generation of words because of cerebral involvement, then a speech therapy, specifically in the early stage of the cerebral palsy evaluation, if we identify someone with speech therapy needs and we intervene early, then these individuals are benefited the most. There are certain medications which are very helpful in managing children with cerebral palsy by decreasing their symptoms of spasticity by using muscle relaxants such as baclofen, diazepam, and also in certain situation localized injection of botulinum toxin, popularly called as Botox, have shown improved quality of life. If physical therapy and Botox are not giving its relevant effect, there is one provision of doing dorsal rhizotomy. And this dorsal rhizotomy is a specialized neurosurgical intervention where we tend to separate few roots and dissect and cut them so that the musculature, sensory nerves are not excited, and thus response to that muscle stiffness is less. We can also do orthopedic intervention to avoid joint contracture. There are various ways to help the affected muscle group by giving wheelchairs to these patients, braces to these patients, walkers, or even communication devices that will help them to have mobility, most importantly, independence, over and above, a better quality of life. These illnesses, where multiple aspects of your body are affected, it causes a lot of psychological stress. So we should not forget to include psychological support in multi-pronged approach to manage these children, where counseling and if possible support groups for emotional well-being and coping strategies are discussed. Patients who are usually children, they have a different way of handling stress. In interventions to improve physical health and to improve mental health at the same time are equally important. Educational support plans where we have customized learning paths which help children with cerebral palsy help them thrive well in school. These interventions usually are very helpful, and early diagnosis and early intervention are very crucial to maximize the benefits of treatment, and overall outcome will be satisfactory. In cerebral palsy treatment, you should also remember that if your interventions are not working, then you should have a mechanism to identify as an endpoint to your intervention, and you revisit your strategy to improve the outcome. Brain of a child has neuronal plasticity, which means a concept of neuronal plasticity means that if some part of the brain is damaged, other part of the brain will learn the function of the part which is damaged. This capacity start declining after 2 years. So early identification with early intervention is key to improve quality of life in a child who is suffering with cerebral palsy. Now we are going ahead with our second question, which is immunization schedule of children. Immunization schedule of children is one of the biggest achievement of mankind in last 3 decades. National immunization program by IAP in India has been instrumental in preventing infectious diseases, specifically infection which are communicable, which have vaccinations to prevent, have decreased the incidence by more than 90%. First, at the time of birth, BCG vaccine, which leaves a scar on left shoulder as a universal mark of BCG, has proven that that immunity against tuberculosis is very helpful. At the time of birth, child will be given BCG intradermally, intramuscularly hepatitis B, and oral drops of OPV. All these three vaccines will initiate an immune response which depends on various factors. And because it's a 0 day of life, immune system is relatively not exposed to external antigens. So with this, child's immune system starts functioning. At 6 weeks, immunization with DPT, IPV, HIB, hepatitis B, pneumococcal, and rotavirus is provided. And these are given to prevent vaccine preventable illnesses, which are mainly going to affect chest, throat, skin, brain, lungs. These, along with GI tract, these vaccines need to be given as uh, booster dosage at 1.5 year, but primary schedule is every 4 week apart. Three doses need to be given at 6 weeks, 10 weeks, 14 weeks. There are modalities where pertussis as a whole cell or acellular is given if child is having febrile seizures or parent wish to go ahead with medication which do not lead to a side effect of fever, then acellular pertussis combination is a well accepted. WHO in few research paper has shown slightly more immunogenicity with whole cell pertussis. Indian government in nearly all the states of India provides combination vaccines and pneumococcal vaccine along with rotavirus vaccine. Rotavirus diarrhea is one of the leading cause of loose motions and leading to severe dehydration in Indian subcontinent. And pneumococcal is one of the most dreaded invasive bacteria related illness which has decreased incidence after using pneumococcal vaccine, and the incidence has decreased by more than 92%. After 6, 10, 14 weeks comes the time of influenza vaccination. In through IAP, we go ahead with influenza vaccination at 6 months with a booster at 7, along with it introduction of typhoid vaccine from 6 to 9 months and MMR vaccine at 9 months. These vaccines are useful to provide protection against typhoid, which is a known infection, bacterial origin, Salmonella typhi. Contamination is mainly through food or water, and incidence decreases by around 84 to 88% after giving vaccination. MMR is life saving, and incidence of mumps in last 2 years have increased. Government has recognized and is working towards it to prevent outbreaks. Even school-based MR campaign with measles and rubella had also been started, and these vaccination are add-on. One set of vaccination are provided by government, and these are complemented with intermittent campaigns such as MR campaign. A very common and very highlighted campaign is a pulse polio campaign, where Government of India provides us with oral polio vaccine, which is mandatory for 0 to 5 year of age of child. and is very useful to avoid infection. Polio as an infection is uh, very harmful for those who have got affected. In 20, 2010, India was declared as polio free, and in 2013 finally eliminated. But we need to keep a very close watch, as one report from Northeast was highlighted where a wild strain related to vaccine had also showcased. So we need to keep vigilant on vaccine preventable diseases, and immunization schedule of children give us a valid provision to prevent these infections. All the vaccines provide immunity to fight against bacteria and against certain viruses, where it gives you gives your body an opportunity to fight that infection efficiently. These vaccines does not guarantee that this infection will not happen, but definitely helps the body to fight against this infection if it is happening in the body. We also should remember that whenever we put any injection, there can be associated side effect. Thus, adverse effects of vaccination should always be known to the patient, to the doctor who is giving vaccination. And as a rule, there should be a provision to prevent life-threatening anaphylactic reaction, which otherwise will be detrimental, can cause bad outcome, and any kind of vaccine related side effects should be informed to the parent and also should be reported to the relevant authorities in India. One important aspect in immunization is cold chain. Maintenance of cold chain during vaccination is paramount, as these molecules in the vaccine are very thermolabile. Cold chain maintenance is priority for better efficiency of all the vaccines. If we have to write of a short note, it should comprises of why we have started. So we have started immunization schedule to prevent infection by vaccine preventable diseases. What is our immunization schedule? It is relevant to government provided at 0, 6, 10, 14, 9 months, 1 year, 15 months, 18 months, then 4.5 years, then 10 years. And it is available free of cost under National Health Mission in all the primary health centers, secondary health centers, and FRUs, and even Anganwadi worker provide free vaccination at rural level. Vaccination prevent infections and decreases incidence of disease by more than 85%. This is one of the way of improving immunity of children and should not be missed. If at all there is a side effect, it should be reported and it should be managed in clinic or in hospital-based settings. Now we will move towards another aspect, that is brief note on spina bifida. The spina bifida is a congenital condition where spine and spinal cord they fail to form properly during early fetal development. It is a type of a neural tube defect, and it can vary in severity, where it is graded into three different varieties. First is spina bifida occulta. Like the main name suggests, it is not physically visible, but evaluation shows that there is a small gap in the spine, and it is the mildest form where there is no protrusion of meninges or spinal cord. It is most oftenly asymptomatic and is detected incidentally, and if present, need to be just kept into observation. We have to get evaluation with an MRI to see whether there is feathered cord associated with spina bifida occulta or not. Second possibility of second category of spina bifida is meningocele, where the top layer, that is meninges, they protrude out of the opening and the sac is filled with fluid. But fortunately, spinal cord is not affected, and this is often corrected with surgery and is relatively safe. Third category in spina bifida is myelomeningocele. That means myelo is spinal cord, meninges are coming out in the cavity. Now, when this extrusion of myelo and meningo is happening, this makes the patient prone for infection, make the patient prone for injury, makes patient prone for paralysis, makes patient prone for bladder dysfunction. In short, it causes nerve damage, paralysis, and other complication, and can also lead to long-term neuromorbidity. There are various causes and risk factors associated for neural tube defect, specifically for spina bifida. Most common are folic acid deficiency during pregnancy. Second are genetic predisposition. Third is exposure to certain drugs, specifically valproate and carbamazepine, or environmental factors such as availability of excess of benzene, that is paint industry nearby. Maternal factors such as diabetes and obesity are associated more with spina bifida. Symptoms are generally categorized. If myelomeningocele is there, you will see definitely will see weakness of muscles or paralysis of legs, bladder bowel dysfunction. You're bound to see hydrocephalus in some certain situation where which is happening because of more area for generation and movement of cerebrospinal fluid. There can also be associated learning and cognitive difficulties secondary to hydrocephalus associated with neural defect in collaboration with spina bifida. Treatment is dependent on type of spina bifida. In occulta, it usually needs only observation, but in myelocele and meningomyelocele and in meningocele, surgical repair is treatment of choice. It can be done prenatally in some cases to repair the birth defect. It can be done natally. It can be done mainly postnatally, where surgery is associated to close the defect so as infection can be prevented. If secondary to spina bifida, we see that the child is now having paralysis of legs or bladder bowel dysfunction, then we start giving them physical therapy to improve their muscle tone. Sometimes assistive devices to manage mobility issue is also added. If there is a hypertonic bladder, then we do CIC, that is clean intermittent catheterization to prevent urinary tract infection. If there is associated hydrocephalus, we intervene by putting in a shunt placement. If there is cognitive, behavioral, and developmental abnormalities, we do a detailed evaluation and we proceed with interventions. Most important aspect again is do early evaluation, take due course, recommend early so that early interventions are started and neuromorbidity and associated behavioral abnormalities will be less. How can we prevent? We can prevent by planning the pregnancy and starting the mother or expecting mother with on folic acid from 400 to 800 microgram per day before conception and during early pregnancy, preferably 3 months before you plan the pregnancy, because this reduces the risk of spina bifida significantly. Spina bifida occulta can be diagnosed on fetal scan, no fetal ultrasound, and accordingly, the expertise of neurosurgeon at the time of delivery, if you plan the pregnancy in center where you have neurosurgery, specialty available, and a neonatal ICU to handle such children, then that makes your plan of care a robust one by anticipating complication. With this talk on short note and brief note comes to an end, and we can we can take questions, and we can share and take care of the doubts. Any questions?
No questions have been asked, sir. You can end the session.
Okay, madam. Thank you.
Thank you.